Okay. Welcome back to Vitals and Voices, where we address the complexities of the American healthcare system, one voice, one solution, and one story at a time. I'm your host, Dr. Felucia Ogunfuditimi. And today I'm excited to have Ashley Bell with us. Ashley is a physician associate, educator, and community leader who's running to represent North Carolina's 10th congressional district. With a career that bridges frontline healthcare and education, Ashley brings a unique perspective on equity, access, and leadership. She's committed to making sure the voices of patients, providers, and the communities are heard in Congress. Ashley, welcome to Vitals and Voices.
Thanks. I'm excited to be here.
Absolutely, absolutely. So we'll just kind of dive right in and see how best we can kind of address some of the challenges. Your website shares a lot of your story, and the story is extremely powerful in terms of your background and what got you here. Could you tell us a little bit more of your life experiences, something that's not on your website, something that can help shape your story and how you decided to now run for office and run for Congress?
I'm originally from rural East Texas and didn't even know what a PA was until I was about to graduate from undergrad actually. And I didn't have any of the prerequisites and just kind of thought about it for about 7 or 8 years and decided to go back. And so I went back and went to Wake Forest PA school. Started working in emergency medicine and then eventually got into teaching. I taught full time for 7 years. I still teach part time. Um,
Good.
But I'm now doing mostly telemedicine, and I
Okay.
work for multiple telemedicine companies. I do, primary care, urgent care, I do a little bit of sleep medicine. So I've kind of spanned the whole gamut as far as, like, clinical
Yeah.
practice. So
Yeah.
but I think the thing that really inspired me to go into politics, well, one of 2 things. One, I was in leadership of the PA profession ever since I was a student. I was in SAPA leadership and was the student director at large for PAEA when I was a student. Later on, joined PAEA as the director of the Future Educator Fellowship, which I had helped start when I was a student. So it kind of came full circle. That was kind of cool. But I've just also been a leader, in the profession ever since, like I said, I was a student, and that has kind of, spurred my interest in leadership. So when everything started kind of, getting kind of crazy around 2016 or so,
Yeah.
I decided to start looking into politics. And when the Dobbs decision came down,
Yeah.
later on, I was working for a women's health telemedicine company at the time, and we immediately got inundated with requests for emergency contraception. And people were
Mhm.
terrified. I mean, I was writing like
Yeah.
400 prescriptions a day for emergency contraception. It was crazy. Um, and, things have kind of started up again, and people are even more scared this time, I think, because they are afraid they're going to lose their insurance, and even as providers, we don't even know really where we're going. I mean, the telemedicine flexibilities expired like 2 days ago, and we still have no guidance. So we're just kind of going with the flow, still seeing patients, doing
Yeah.
whatever.
Yeah.
But I feel like my experience kind of in healthcare and education, as well as just my experience being a leader in the profession, kind of uniquely sets me up to do this.
Yeah, so I mean, you've already kind of alluded to it. As a provider, we tend to be apolitical, so to speak, in terms of just treating whoever's in front of us. And as much as we try to divulge ourselves from, the political aspect of healthcare delivery, those two things are intertwined. Everything we do is either governed or regulated or has restrictions that are at the mercy of healthcare policies and legislators and policymakers from that standpoint. So it becomes critically important that we, one, embrace the fact that, we can't necessarily be too far away from the politics, but also understanding that what drives us towards healthcare delivery is our passion towards taking care of patients. With that being said, it's important that we advocate for appropriate laws and appropriate policies to be written and regulations to be written that can help us deliver care the way we want to deliver. Which kind of brings me to my next question, which is, what are some of the priorities that you hope to accomplish being a healthcare provider if you do get elected into Congress? What are some of the things you want to start working on?
Yeah, so looking into how health policy is kind of shaped in Congress, I've always been kind of surprised that it's intertwined with other priorities in committee. Like, I mean, I feel like healthcare is such a complex issue. It really should have its own committee, like not just a subcommittee, but like an actual committee. And I really feel like healthcare providers should be the ones dictating healthcare in this country, not people who have absolutely no training in medicine like we're seeing right now with HHS. And, because those things have consequences. We're seeing already, big time issues with lack of guidance from HHS and CDC not really having, I guess, the credibility that they used to have. And so that's going to be kind of my first priority is how can we make healthcare its own priority, not intertwined with all of the other priorities that the country
Yeah.
has.
Yeah.
Ultimately, of course, we would love to see universal healthcare, but that's going to take, I mean, it's going to take years. So we have to kind of chip away at it piece by piece, and we have to hold control in Congress so that we don't get those things undone by people who don't understand.
100% agree with you in terms of trying to set aside healthcare in its own lane in Congress. That way, when we're having these discussions, they are robust from a research standpoint, they're robust from a understanding, from a policy development standpoint, but also getting that information out to the communities, out to the public about the importance of healthcare delivery and how that is impacted by policymakers and what happens in Congress. When I was president, I typically talked about patients, practice, and the profession. The thought behind that was, how can we have at least some defined pillars in healthcare that drives our message from that standpoint? Do you think that Congress has a role in coming up with maybe some defined healthcare pillars that's easy to understand, that everyone can relate to when we're talking about healthcare? Patients understand it, policymakers understand it, legislators understand it, and healthcare providers understand it. That way we can open this up as much as possible. Do you think Congress has a role in kind of defining how, we talk about healthcare?
For sure. I think, Congress has the ability to kind of make healthcare as complex or as less complex as, as it
Yes,
can be. And right now it's pretty freaking complex.
complex.
Yeah, and so I think if we can simplify things, because I mean, even people in Congress don't understand, even healthcare providers don't understand everything that goes on in healthcare. If you try to, go into Medicaid, it's just, I mean, the mind is just boggled. So, I think as long as we keep patients at the center of what we do,
Mhm.
that's the most important thing. But I think that we also have to write policies that benefit patients, but also don't forget the providers in this, because if we don't have providers and we don't have healthy providers that aren't burnt out and, like leaving the profession after 5 or 6 years because they're so burnt out, if we don't have that, then we
Yes.
can't treat the patients.
Yeah.
So I think that policy really has to focus on not only doing what's right for the patients, but also doing what's right for the providers. And I think the provider part kind of gets missed a lot of times.
I would agree with that completely. And that's why, one of the things we've talked about, and I mean, the formation of Vitals and Voices really came from how we can focus on the healthcare workforce shortages that we anticipate that are coming down the pipeline, and the role that providers have: PAs, nurse practitioners, physicians, pharmacists, physical therapists, everyone that is involved in delivering care. We have a massive shortage of those providers, no matter how much of a scope of practice each one of those professions has. And so understanding that and being able to break that down in simplistic terms, as you've just talked about, is critically important moving forward in Congress. And, having your voice there is one of the things that, we can kind of look forward to. So, talking about that, what can the people of North Carolina's 10th district really expect from your candidacy? You bring a broad message, but unfortunately, I don't live in North Carolina. I can't vote for you, but those that do, what can they expect from their candidacy, from your candidacy rather, and how do you expect to deliver on that?
Well, I'm going to have to be really aggressive with my candidacy. I'm in a very red district with a candidate who, without using too many offensive words, really is not concerned about anything other than padding his own pockets, in my opinion. He's a gun manufacturer, so that just kind of adds a whole layer onto things. So I'm going to have to get really aggressive and put some, as Dr. Phil would say, put some verbs in my sentences and come up with some actual solutions to what we're facing. I think too often politicians just say what would be nice to do, and they kind of have their talking points and everybody agrees with their talking points, but then when it comes down to it, there's no real path forward. And so I've already written some kind of draft bills as to
Mhm.
things that I would like to see happen. So, those are plans for what would happen if I
Yeah.
got in Congress.
Okay. All right. I mean, that sounds good. And sometimes, if you have the passion for this, you have to be able to make sure that you're all in. And part of that is being able to use the tools that you have available to you to be able to kind of get your message out. And I'm hoping that this is one of those platforms that we can use for that. So, talking about, you being a healthcare provider, you understand the healthcare system, you also understand politics, and you're getting more into national politics. If there's one thing that you can change after you get elected, what will be that thing? What would be that, if you had a magic wand, so to speak, what would be that thing that you can change that can help to improve the lives of Americans?
Well, if I had a magic wand, we would all immediately have universal health care because I think it's kind of crazy that we're supposed to be the greatest country in the world, but yet, we're also one of the few, I guess, larger, more established countries that doesn't have it. And so people shouldn't have to be wondering about what's going to happen if I get sick. And then if they get sick, they shouldn't be forced into just insurmountable medical debt because they can't afford their bills. So that would be my, pie in the sky type dream. But if I had to start with one, attainable thing, it would be rolling back these Medicaid cuts that have
Okay.
been put into place by the big beautiful bill. In my district, there's something like 60,000 people that could see cuts. And when you think about my district is mostly rural, potentially could have rural hospitals close in my district, and people already have trouble accessing care just because there's just not enough of it out there. So that would be the day one type thing that I would be looking for, is to kind of roll back some of these cuts.
Yeah, I think that's an extremely good approach. We've already talked on this show about the challenges that we anticipate if all of the measures go through with the one big beautiful bill that was passed, as well as the impact on the H-1B visas with healthcare workforces. These are things that are coming down the pipe, and we just need to prepare for it. And you mentioned, the impact on rural health and patient access. We already have a significant challenge around that, even if everything were the way it is right now. Any challenges to funding, to Medicare, to Medicaid, to provider availability has a direct impact, particularly in rural areas or areas of underserved communities. So anything that we can do to be able to address those directly, once again, to enlighten and to engage policymakers and legislators on the importance of protecting those mechanisms, comes as something that we would absolutely cherish. So it is exciting that, as a fellow PA, we have PAs getting into politics. It's something that I think we need more of. We see that with other professions, with physicians, with physical therapists. We have a few PAs who've definitely run for office and who have gotten elected, and we have some that are in right now as well too. But I think we need more of our profession in various levels of. politics, both at the state, the national, and even the local level, to help to continue to open up the discussion around advocacy and patient advocacy and the importance of protecting providers from burnout and everything else that we've talked to. So thank you. Do you have any last minute thoughts on anything as we wrap up?
Yeah, I will just share my website. It's AB4, the number 4, ab4nc.com. And you can see more about myself, the issues I care about, even donate to my campaign on the website there. And, I would just say that, we really have to pay attention to what's going on in the country right now. It seems like every day is a new disaster lately, but we have to stay engaged so that, we can continue on past 2026.
Well, thank you very much, Ashley, for being here. Thank you for talking to us today. It is critically important that we continue to have these discussions. Once again, on this show, we try to remain apolitical as much as possible and just try to get the word out around challenges with patient access and provider and workforce shortages. But we realize that there is really a thin line between the politics and healthcare delivery. And the more we can be comfortable discussing those challenges, the quicker we can kind of come to some solutions to be able to make sure that we're improving access to patients. So thank you for coming on board today. And to our listeners, thank you for tuning in to another episode of Vitals and Voices. Once again, this is an opportunity for us to be able to share how we can find solutions towards the challenges that we see in healthcare today. Thank you very much and have a great day.
Thanks.
Thank you.